Why isn't she doing anything? I just feel like I can't breathe.
Hi, Janice. I'm Dr.
Are you going to do anything for me?
I am. I'm going to help take care
What
of you.
is she doing?
I need to take a quick listen to you.
Blood pressure cuff on.
Why do you need to take my blood pressure?
There may be something wrong with your heart, so we have to monitor your blood
Okay,
pressure.
based on your assessment and off of your BNP lab results, I think you're in chronic heart failure.
What?
Yes, so we're going to need to get you on medication to help that, okay? We're going to do the best we can by helping you. The nurse will get it started for you, okay? I wonder what I can prescribe for this chronic congestive heart failure. Might look on ads to see what they have nowadays online.
Are you constantly taking care of multiple heart failure patients? Do they keep coming back for the same reason, over and over and over and over again? What are you prescribing your patient? Is it even working? Do you need some answers? Try Dobutamine. Dobutamine is typically used for management of heart failure caused by depressed contractility from organic heart disease or surgical procedure. Dobutamine increases cardiac output without significantly increasing heart rate.
Hi, I'm a doctor and I prescribe Dobutamine to my patients. It saved their lives.
Contraindications for Dobutamine include hypersensitivity to Dobutamine or bisulfites and idiopathic hypertrophic subaortic stenosis. You should use cautiously in patients with a history of hypertension, as this drug increases the risk for exaggerated pressure response. Patients with MIs. Patients with atrial fibrillation, which should be pre-treated with digitalis glycosides. Patients with a history of ventricular atrophic activity, as this may exacerbate their symptoms. Patients with hypovolemia, which needs to be corrected before you administer this drug. Patients who are pregnant or lactating, as this is not safe for them.
My doctor has tried all kinds of meds on me. So far, Dobutamine has given my heart the care that it needs to stay active and healthy. You should probably talk to your doctor.
Side effects include, but are not limited to, headache, shortness of breath, hypo and hypertension, increased heart rate, PVCs, angina pectoris, arrhythmias, palpitations, nausea, vomiting, phlebitis, and hypersensitivity reactions, including skin rash, fever, bronchospasm, eosinophilia, and non-anginal chest pain. Be sure to report significant changes in vital signs or arrhythmias, palpate peripheral pulses, and assess appearance of extremities routinely throughout Dobutamine administration. Potassium concentrations during therapy may cause hypokalemia. Monitor electrolytes, fun, creatinine, and prothrombin time weekly during prolonged therapy. If overdose occurs, reduction or discontinuation of therapy is the only treatment necessary due to the short duration of Dobutamine. IV vasoactive medications are potentially dangerous. Have a second practitioner independently check the original order, dosage calculations, and infusion pump settings. Do not confuse Dobutamine with dopamine. If available for floor stock, separate the two. Explain to patient the rationale for instituting this medication and the need for frequent monitoring. Advise the patient to inform the nurse immediately if chest pain, dyspnea, or numbness, tingling, or burning of extremities occurs. Instruct the patient to notify the nurse immediately for pain or discomfort at the site of administration. This medication bears a heightened risk of causing significant patient harm when used in error. This drug may interact negatively with nitroprusside, beta blockers, some anesthetics, MAOIs, oxytoxics, and tricyclic antidepressants. While giving this medication, you should monitor blood pressure, heart rate, ECGs, pulmonary capillary wedge pressures, cardiac output, CVP, and urinary output continuously during this administration.
Thumbs up. Dobutamine saved my life.
Talk to your pharmaceutical rep today. If you believe in it, it will believe in you.
Oh, Dobutamine, yeah, to decrease the heart rate and increase the contractility of the heart. I think that's what I'm going to give her.
I know that was fast, but your doctor
Yes, she just came
diagnosed
in,
you.
just
Yeah.
doing a medication, didn't tell me anything about it.
Yeah.
What's
well,
going on?
You seemed pretty anxious, but I think your doctor diagnosed you with heart failure. So she wanted to start a Dobutamine drip on you. And
What is that? What is it?
a Dobutamine drip, it will help your heart contract and it will pump your blood through your body better than it has been doing. And there are some side effects to this drug. Those can include an elevated respiration rate, an elevated blood pressure, some chest pain. But please let us know if you experience chest pain or have any issues with breathing. In addition, you need to tell us if you're experiencing any numbness or tingling, because that is really important. That can be a dangerous side effect to this drug. So let a healthcare provider know as soon as possible if you have any of those symptoms.
1, 2, 3. Dobutamine!